Morning, everyone. We're going to give it a few minutes to let the participant list populate here. For those who are just coming in, we're just going to give it another minute to allow folks to stream in here, and then we'll get started. All right, it is 9:32, so we'll get started here. I just want to thank everyone for joining us this morning on our webinar about the importance of bringing greater price transparency to our healthcare system. Before we get started, just a couple quick housekeeping notes. Today's webinar is being recorded, so if you know anyone who's interested in this subject, feel free to share it. We'll have it up on our YouTube page later this afternoon. And then later in the webinar, we'll also have some time for Q&A from the audience. Down at the bottom of your screen, there should be a Q&A or chat function. Either will suffice for asking questions. Feel free to send them at any point during today's presentation. So to get started, want to introduce our guests here. We have Senator Mary Felskowski joining us. She's a Republican state senator representing the 12th Senate District in northern Wisconsin. She was first elected to the state Senate in 2020 after serving in the state assembly since 2012. Senator Felskowski serves on the legislature's powerful Joint Finance Committee and also chairs the Senate Committee on Insurance and Small Business. She's a lifelong resident of Lincoln County and outside of the legislature owns an insurance company. And then we also have David Balott joining us today. He's the director of the Right on Healthcare initiative at the Texas Public Policy Foundation. He has broad experience across the healthcare spectrum with expertise in healthcare finance. He's a former congressional candidate and was a hospital executive for over 20 years in Texas. So I guess before we get our panel discussion started, I was going to kick it over to our research director, Will Flanders, who's written about this topic and was going to present a short presentation to kind of set the stage for our discussion today. And I'll get that up here.
Awesome. Thanks, Kyle. And I'll give a second to get it full screen there. So yeah, thanks to everyone for joining us. And again, as you have questions throughout, please feel free to put them into the chat. But healthcare price transparency is an important topic because healthcare costs have been increasing around the country. Healthcare costs are a major concern for many Americans. According to a recent study from the RAND Corporation, Wisconsin has the 4th highest hospital costs in the nation. So even relative to the rest of the country, we're a state that has a high cost of care, and obviously across the country, this is a huge topic of discussion as well. There was a recent poll from the State Policy Network, which is a sort of national organization that both TPPF and Wisconsin Institute for Law and Liberty are members of. And they found that 85% of Wisconsinites in April said that healthcare costs are an important problem that needs to be considered. So this is something that across the board, folks think is important. And the fortunate thing is this is an issue, solving this issue is something that gets bipartisan support. The idea of healthcare transparency is popular across the political spectrum. So here's another recent poll that 90% of folks support giving people the information they need to know their healthcare costs at least 72 hours prior to non-emergency care. So this is something that isn't a 50-50 issue like most of the issues that we deal with. This is something like a 90-10 issue. So something that gets across the board support. So what is healthcare price transparency? Well, this is the notion that we ought to give folks better access to information about what their costs will be. This isn't a completely new idea, though it's certainly gotten a lot more attention in recent years. And there are states that have implemented something like this even prior to the federal legislation that we'll discuss momentarily. But New Hampshire was one of the first states to implement something like this. It sort of predates the federal model. Basically, they created a system where there is a one-stop shop where folks can go and sort of get an estimate of their costs for non-emergency procedures. They did this about 10 years ago. And an early study of that process found that there was significant savings for both taxpayers and insurance companies when prices are known. When the market works and people know what their costs are going to be, those costs can eventually go down. We also did a study back in 2019 that looked at transparency laws around the country from a national ranking, and we found that states that have states that have better transparency laws in place, and back then not many of them were that great, but there was enough to have a ranking, that folks are more able to access care and less likely to forego healthcare because of the costs. So what happens at the federal level, and why is that important? Well, in 2019, President Trump signed an executive order that sort of created the basic process for price transparency. There was supposed to be the creation of a machine-readable file, and that was supposed to be translated into a patient-friendly format so that folks could actually access information about their costs across the country. But some of the problems with this, and I'm sure our panel will discuss this in more depth, is that compliance rates for this federal mandate remain relatively low. A February 2023 report found that only 44% of Wisconsin hospitals were compliant. There's some variation in the percentage of compliance depending on the source you use, but the bottom line is there's not full compliance across the board, certainly. And there are some states that have passed laws already to sort of model after the federal policy. That includes Texas, which is one reason that David is joining us today, as well as Colorado. So with that, I'm going to turn it back over to Kyle, and he's going to start with some questions for our panelists.
Yeah, and I think we'll get things started with Senator Felskowski. About 2 weeks ago, you and your colleagues introduced the Know Your Healthcare Costs Act. So I don't know if you could tell our participants what that bill does and kind of why you think it's important.
So thank you, Kyle, and thank you very much for hosting this. So basically, our bill models the federal legislation. It's asking hospitals to have machine-readable files on their websites, as well as some shoppable services, so that consumers know what their costs of healthcare are. But what it really does is it puts teeth into the federal legislation. So if hospitals and our health systems are non-compliant with this, then it gives DHS the ability to work with them first to try to get them into compliance. And then if they continue to be non-compliant, then it gives them the ability to find the health systems so that they do come into compliance. And, our health systems are pushing back on this a little bit because they said it's already federal law, but the federal government is not doing a good job getting our health systems into compliance. So this just gives the state the ability to put some pressure on our health systems to make them compliant. And I just keep going back to the fact, what other commodity, anything that we purchase out there, do you not know what you're paying prior to the purchase? The fact that we are even having this discussion kind of blows my mind, that we have to put pressure on our health systems to make them tell somebody what their costs are going to be prior to having a procedure done.
Couldn't agree more. I guess, David, you have a background as a healthcare executive, I think serving in a lot of roles where you deal with some of these pricing challenges. I guess, can you explain from that perspective why folks in the hospital industry should maybe think differently about this?
Well, there a lot of the opposition has been, well, it's too complicated, it's too difficult, it's not something that we can accomplish. But that's just not accurate. It's just a matter of, do they want to do that? And we're seeing for non-emergent, non-urgent type of cases that are done on an outpatient basis in some hospitals and in many other ambulatory surgery centers. Not only are they transparent with their pricing on a per code basis, they're providing bundled pricing up front that allow people to be consumers. Because even with what is what we're talking about here at the federal level and in Texas and in Wisconsin, that's a first step. It's a very important first step. What we're looking to accomplish in the future is, how do I know what that ACL repair of my left knee is going to be in advance, in that 72 hours, as we saw in that one statistic from Will. Those are the next steps from this very important foundational one that we're looking to accomplish at the state level here in Wisconsin. So it's going to require a paradigm shift for hospital executives, for them to understand their costs and be able to function like a traditional business, because that's not been the case. Healthcare finance is something completely other. And it's time for those professionals that are capable of doing this to do it. And I've always believed this, is that entity that will be first or second to market will be the ones that will command more of the market share, because the employers will flock to that type of entity.
Speaking of employers, I think it's brings an important point forward on this transparency bill. We've had a lot of employer groups come out in support of this. And Senator Felskowski, you work in the insurance industry. I guess, can you give a perspective of why you think employers are so supportive of this concept?
So just going back in history a little bit. So 25, almost 30 years ago, I had the pleasure of being in West Bend, Wisconsin, and I met John Torinos, who was a owner of Serigraph. And at that time, John had actually employed someone to reach out to the healthcare systems in his area to find out what were they charging for services. And when he did that, he put together a database, and then he went to, the high deductible health plan. John was way ahead of his time on this. So I took all that information and I took it back to my small community in Tomahawk, which is under 33,000 people. And I tried to recreate John Torinos's model with a group of employers in my area. And I will tell you what, we fell flat on our face. Trying as a group of, like, I had 4 employees at the time, some other small employers, trying to find out what our health systems were charging so that we could try to direct our people to, like, the lower cost services. It was a nightmare. I took a week out of my life and just called around, and I couldn't get any straight answers about, like, what was the mammogram going to cost? I couldn't find out what was the cost of any of the services that I was asking about. So that kind of all fell flat on its face. So here, fast forward 25 years, I'm now in the legislature, and we're still having this conversation about what is the cost of my health care. And employers want to provide healthcare for their employees. They want to give them a good product. But the system that we have in place in the United States, as well in Wisconsin, is like hindering employers from doing that. We are making them jump through so many hoops and do all of these things to try to provide a product to their employees. It's absolutely ridiculous. And I just keep going back to the fact that, what else do I purchase? Like, my husband and I are doing some remodeling in our home. Do you think that I just go up to Menards and say, here's my credit card, I want X, Y, and Z? Or do I shop those products and I compare them to Lowe's, or I compare them to Tomahawk Builder Supply? We do that in our world. Why do we think that we do not do that in healthcare to get the best product for the dollar? It's like this. I just can't believe that this is the world that we live in. And no consumer should just hand a blank check to someone and say, well, I need this done. Here's my checkbook. I have no idea what it's going to cost me, and what is this going to do to my finances going forward.
And important to note that the businesses you're talking about, Senator, are nonprofit community-based entities. They're there to serve the community.
Absolutely. It's mind-blowing to me that we're even having the conversation, or that the government is involved in a conversation to say you have to tell people what prices you're going to charge them.
Yeah, and I think one thing you brought up is, this is very patient-centric, right? And you've been a leader in the legislature on kind of putting forth legislation, bringing ideas forward that put the patient first and really make sure that we're addressing affordability and access. So I guess, can you discuss a little bit like why these issues are so important to you? Is there some backstory there?
Well, I've had my own healthcare challenges, and I've been extremely fortunate. I've gone through cancer twice and some other things, and I've been extremely fortunate to have like phenomenal healthcare, right? But I've worked in an industry, in the insurance industry, where I've seen the trend for, I mean, I remember my baby's 32 years old right now, but we had a 0 deductible health plan. At the end of the year, I got a printout of what all my costs were. And we've gone from that to, I have constituents as well as clients that have a $10,000 individual deductible because that's all they can afford, right? They're foregoing healthcare because of these high deductibles. We just had a benefit for a gentleman in Tomahawk who is with stage 4 cancer because he didn't go in because he was afraid of the cost of going in. So you have health insurance, you don't have healthcare, and that's wrong. We are the richest country in the world. People should be able to have healthcare, but we've set up a system where people are afraid of the cost of healthcare, and they're afraid of what it's going to do to their finances going forward. And we have the ability in Wisconsin to take that away. So you can know what your costs are going to be. I want people to go in, I want people to get their checkups. I want my constituents to be able to afford their health care. And we can do that in Wisconsin. And this is just the first step in getting us to that, so that people aren't afraid of their health care. They know what it's going to cost them. They can plan on it, and they go in and they get their issues taken care of in a timely manner, so they don't become so exasperated and then it's life-threatening.
And if I may, what you just said reminds me of one of the big points of opposition from the hospital industry. And it's that people don't care about the cost. They care about their benefits. They just care about what their insurance benefits are.
Yeah.
That, because of what you said, that's entirely inaccurate. Because when you have an average deductible of between $5,000 and $6,000 nationally, I don't know what it is. I don't know what the average is for Wisconsin, but I bet it tracks.
Yeah.
And with 60% of Americans or more having less than $1,000 in their bank account,
Right.
we're cash buyers, we're cash payers. And at that point, it's incredibly important for us to know what the price is. We did, everybody's familiar with what polling is. We did a study that's called value laddering. And it essentially asks, what are your values? Why do you believe what you believe? And why do you end up making the decisions that you decide on? And it came down to two as it pertained to healthcare. One was people wanted a sense of agency. They wanted to be empowered. And number two, they wanted a sense of peace of mind.
Mm-hmm. Transparency
Gives them both.
And David, you made a really good comment there, and I think this is really relevant. So the average, Tomahawk's very fortunate. We have some really good industry in our town. So I'm going to say that the average person in Tomahawk maybe makes $50,000 to $60,000 a year. Their healthcare deductible is 10% of their income, right? 10% of their income. And so they're afraid of going into that and not knowing what it's going to cost and having all of these medical debt. And medical debt is the number one reason for bankruptcy in the United States, number one reason for bankruptcy in the state of Wisconsin. And to think that we don't tell people what something is going to cost them so that they can plan for it is ludicrous.
Well, and if only it was just the deductible, because you've got the premium, certainly that's subsidized by the employer. But if you just look at the premium amount alone for a family of four, it's a little over $22,000 according to the Kaiser Family Foundation. That's a brand new car every year.
Right.
And that gives you the great privilege of having an insurance card in your wallet. And then you have a $5,000 to $6,000 deductible. And that's not all. That's when insurance will pay $1. But then beyond that, you've got a coinsurance up to an out-of-pocket maximum. So it's far more than 5%.
Right. And, I think when it comes to your children, I think families, it doesn't matter what it's going to cost for my child. My child will be in there. They will get all of their health care. It's mom and dad who forgo having the health care done to them because they're afraid of that cost. And that's just wrong. And then that leads to, exasperated costs down the road and tragedy for a family. So we can get a handle on this. And that's what we're trying to do with this legislation. We're not attacking our health systems. We're not saying you're the big bad monster in the room. We're trying to empower our constituents so they can get a handle on what they're spending and be able to plan for, God forbid, the tragedies that come and the healthcare costs that they need.
Yeah. Empowerment and peace of mind. And I would believe, and I do believe, that the hospital systems want the same thing for their communities. And I do believe at some point that this is something that they will embrace and provide that benefit to the folks that they serve.
You know, and as a state legislator, it's like, well, the federal government's doing this, the federal government's doing this. I am so tired of waiting for Washington. And we are not in Wisconsin going to sit back and wait for Washington to solve our issues, because Washington is so dysfunctional at so many levels. We need to start taking the bull by the horns and getting things done at the state level. And that's what we're trying to do here.
Yeah, David, I think one of the other criticisms we've heard of price transparency is that patients won't actually use it. Can you kind of address that concern that people have? And I think it's an unfounded criticism for many reasons, but do you have any thoughts on that topic?
Well, it's based in some history. There have been some efforts in the past where it's just not been utilized, but there's been nothing like what we have today. But the fact that there's been very little compliance, and when you look online, it's incredibly confusing. And there's been intentional efforts by some, whether it was intentional or just being complacent about it. It's challenging. I mean, even for me. But if you need an X-ray, or you mentioned a mammogram or a CAT scan, that's typically one code. That's something that someone can easily look up and compare from facility to facility. Say they have Aetna or a Blue Cross. They can go to that column where Blue Cross is, look at that CPT code, and understand based on the contract that the cost at the hospital A is going to be $700 for a CT scan and $1,200 at hospital B. Well, if my deductible is $5,000, where am I going to go? So that should be the decision that people end up making or getting to. So yeah, no, I think that the adoption will pick up when compliance is improved. But as I mentioned before, this is all a first step. Mm-hmm. And when we saw transparency get introduced to the airline industry in the early 2000s, that's when you saw a lot of third-party organizations get involved as well, like at Expedia or Travelocity, whoever it was in the beginning, I don't recall, but they revolutionized air travel. Not only did the prices go down, the quality increased.
And there's something else. Society is trained, right? So we've been trained, and I spoke about 32 years ago, at the end of the year, I got a printout of what all my healthcare costs was when I had my child. So we've been trained not to know healthcare costs and not to shop health. That's the way the industry, and nobody did this like deceiving anybody, but that's just how society works right now. As we change that, and using David's example around the airline industry, I mean, I remember calling a travel agent 35 years ago and saying, hey, my husband and I want to go on a cruise. And she got me the best deal that she could find, and she gave me like 5 options. Do I do that today? Absolutely not. I go on Orbitz, or I go on American Air, whatever it may be, and I shop for the best price. Do we not think that will happen? Turquoise and the health systems in Wisconsin are using Turquoise as a model. So I went out on Turquoise and I put in a hip replacement, and it said that the average hip replacement in my area is $4,900. But it doesn't tell me, is that the doctor's cost? Is that the hospital cost? What is my overnight stay? So it's not a lot of information. So if I rely on that right now, was not all the extra data that we could be putting into that, I'm going to say, well, this, I'm going to pay, I have a $5,000 deductible, I'm going to pay for my own hip replacement, but it's not an all encompassing cost. And we're trying to get so that people know, how do I plan for my hip replacement that I know I'm going to need in the near future? So I know I'm going to have a hip replaced. How do I know where to go? How do I know what the cost is going to be? How do I know what my deductible is, but let me plan for it. And that's all we're asking for, is allow people to shop their services, know what the cost is going to be, and allow them to plan for these large costs that they're going to be facing in their healthcare world.
I think Senator Filskowski hit the nail on the head there. I think, awareness is a huge key, right? A lot of folks even after a system is implemented, right? We do a lot of school choice work. There are folks even today that don't know the school choice programs exist in Wisconsin, for example. So, but even on the margins, with the research we mentioned at the beginning in New Hampshire and some of the research that we did, there is at least a little bit of evidence that this stuff is beginning to happen. And as both of you guys have said, it will take time, but building awareness is absolutely key once these changes are made.
We had a great meeting yesterday with a lot of employers. And we were on a panel with WMC, and one of the employers there is doing a great job. They now have an on-site clinic. They're empowering their patients. They're educating them on what different things they can do and what the costs are doing. So this is another tool for employers to provide amazing healthcare and options for their employees. So is John that, owns a resort in northern Wisconsin going to know about this, the minute it passes? Probably not. Society, it's going to take time for it, but our employers are going to know about it, and they're going to utilize this, and they're going to help their employees find the best healthcare at the best price. So knowledge is empowerment. It doesn't matter what the industry is. It doesn't matter what the subject is, and knowledge will empower employers to do better for their employees. And that's what they want. They're asking for this. Let me give my employees better healthcare. Let me give them lower cost healthcare. Let me empower them so that employers love employees. And I don't care what anybody says. We want the best for our employees. And this is giving them a tool to be able to do that.
David, I guess you're instrumental in helping getting a similar bill passed in Texas. I don't know if you can kind of share your perspectives. What did the opposition look like there? Was it a bipartisan effort? Was it easy sailing, or were there a lot of challenges there?
It was pretty easy sailing in a session where there was a lot of tumult. It was a bill that made it through the House committee unanimously and off the House floor unanimously, and then going to the Senate, making it through that committee unanimously, and then again on the Senate floor with no opposition. So it was something that I was extremely happy to see happen, because it really demonstrated that healthcare is about people, not about politics, nor should it be treated as a political football. And if you look at transparency, that's exactly what the constituents of all the lawmakers are saying. A 90-10 issue. With the 10 probably working for the hospital industry. But people generally want it because it's a kitchen table issue. When there's an increase in healthcare cost, there's going to be a decrease somewhere else because we have balanced budgets as a family. So it really went through quite well in our session, and people saw the need, and the grassroots did an amazing job of making their representatives aware of their interest in getting this across the line.
And Texas really was one of the first states to pass a state-based transparency bill that models federal legislation. Has there been momentum in other states after that as well? And has the experience been similar?
There has been, but the experience has not been similar. It's been challenging in other states, depending on the amount of consolidation by hospital systems. And so if you have less players that have more market share, it's much more difficult to get that through in particular parts of the country. Texas is a big state. We've got a lot of players, so it was really the people that prevailed.
Gotcha. And I guess I'll kick that back to Senator Felskowski. What do you see the prospects of the Know Your Healthcare Costs Act this session?
So I'm very optimistic in the Senate. I've had great conversations with my colleagues in the Senate around moving this piece of legislation. I'm seeing very good support on it. I don't know as much in the Assembly. I just haven't had the time right now because we're in the budget session. So I haven't had the same conversations in the Assembly that I've had in the Senate. So I'm not as optimistic about the Assembly, but that's just because I haven't been able to have those conversations.
Great. And I guess I think David touched on this, and you had touched on it earlier. This is the first step. What do you see as kind of the next important steps to making healthcare information more accessible to your constituents?
So we have another bill that's gonna be coming out here right now for an all payer claims database. Right now, it's not mandatory in the state of Wisconsin. We have a bill that's coming out that is gonna make that mandatory, which will just feed into this so that it'll give even more data to, employers, machine readable, that will allow them to be able to plan like what kind. 88% of the lives in the state of Wisconsin are insured on self-funded plans. So it will allow employers to navigate the systems better and to know which networks they're going to become involved in so that they can lower their costs that way. I have another bill that's going to be coming out probably this fall around pharmacy benefit managers. And then healthcare in Wisconsin is an ever moving target. We're looking at how do we bring in more physicians? How do we increase our workforce? A lot of different things. So we're working on costs right now and to help employers with that, but then we're going to move over into the workforce issues that a lot of our employers and health systems are seeing. So it's a huge pie that we're going to be working on this year.
We did have a question in the chat. What is the level of fines in the bill for non-compliance? I figure we'd just get that one in there real quick.
So I'll just do a 30,000 foot view on that. So we have the fines so a fine, let's say for smaller systems, the fines are lower, and for larger systems, the fines are higher. So that we're not, this is not about hurting our health systems. This is about encouraging them to be compliant. And what happens is day one, let's say the fine is $500 on day one. Day two, that fine doubles on day one's fine doubles. And then there's another fine on day two. So we have these compounding to really encourage them to be compliant. The fines is the last step, Will, and I really, really want to emphasize this. We give DHS the ability, and we empower DHS to work with the systems to be compliant. What is your plan of action? How do we get you to compliancy? The fines are the last resort. We do not want the fines to ever come into play. We want compliance with our systems, and we want DHS to work with them in a plan of action first. But the fines are hefty, and the fines will be, the fines are the last resort. And I want to emphasize that. We want compliance, but if our systems refuse to be compliant, they're very hefty.
And as we're getting towards the end here, I just want to remind anyone, if you have any questions, please type them in the Q&A section and we'll get to them. David, I guess piggybacking off of our last question of the senator about kind of trends, what do you see as the trends going on in Texas and other places to empower patients?
Well, I like what Colorado did in their last session. They offered some patient protection. So if a hospital was not compliant, it didn't require transparency. It didn't require that they put that out. But if they didn't, the patient can't be sent to collections, can't have their credit reported to the bureaus, and there can't be any litigation against the patient. So it takes away the fear of punishment from the patient if the hospital chooses to not be compliant. So it's a different approach altogether, but I think they are looking at introducing a transparency requirement as well in that state. What I would like to see is, if you go to a standalone imaging center, or if you go to a surgery center, or if you go to any type of outpatient type of facility, which hospitals do a lot of outpatient work, upfront what that dollar amount is going to be. What I'd love to see in the future is you can call the hospital with a valid order. You can say, I need to have CT of the brain with and without contrast, for them to be able to either have it on their site or have somebody be able to provide them with that information. Say, it's going to be this much. This is how much it's going to cost you. And then armed with that information, you can go to other hospitals in your network or out, whichever hospital, if you don't have insurance and you're just a cash payer, you should be able to see and know what the price will be so that you can make an informed decision. That's the next step. That's the optimal situation from my perspective.
And you raise an interesting point there. I think there was a study out of Johns Hopkins. They looked at, I think, 70 or 75 different popular primary care treatments to see whether or not the cash price versus the negotiated insurance price would actually be more or less. And I think in almost half of those procedures, the cash price ended up being less than the negotiated rate. So I think there's something to say about transparency being important, that people can actually get a better deal when they just pay out of pocket sometimes.
With the cash price policies pertaining to charity care and hardship that the patients can apply for, it most certainly can be much less than the negotiated rate, which is counterintuitive, because you join an insurance company because you feel or believe that they have enough membership that they have the leverage to negotiate better deals. But that's just not the case for a number of reasons that we probably don't have time to get into today.
You know,
Well-
we're seeing a trend in Wisconsin also. We're watching our employers start to use more direct primary care models. And we have a direct primary care in a neighboring community by me. So I called up there and I asked them, like labs and different medications and stuff. I was blown away by how inexpensive it was, right? And the lab work. And then I watched as I had my labs done, and I went to my direct, my primary care doctor, and I'm looking at the bill, and it was like 50 or 60 times what the cash price was at the direct primary care. So to say that we do not need this and it's not necessary, it blows my mind. Patients have to be able to get a handle on these costs, because we're seeing the cases, and we're seeing people that are not doing their annual exams. They're not going to the doctor. They're not doing what they should be doing. And then down the road, costs are exasperated, right? Because things are not being caught upfront and early. Quality of life is not there, and it's just ridiculous. It blows my mind that the government that we are even having these conversations, that you have to know a charge or a cost. The government has to step in and say, you have to post your costs. It's ludicrous to me.
It falls in line. It falls in line with the culture of the healthcare industry. We're not a healthcare. We don't really have healthcare. We are a sick care system. Everything is based on something that's wrong. Having a diagnosis code, having a CPT or some kind of code that indicates a therapy. It all starts with something being wrong. There are very few reimbursement methodologies. DPC, or direct primary care, is one that has a reimbursement methodology or a payment methodology that encourages and motivates health care, preventative care, looking to improve the health of the individual. But our healthcare system overall is more of a sick care reactive system.
Yep. Well, I guess I think before we go, do either of you have any closing thoughts? And we really do appreciate your time today.
No, I'm just very encouraged by the support that we've gotten for this bill. And I'm just hoping we can get it done for the constituents of Wisconsin.
Yeah.
And I want to thank Will for all your support in this.
Yeah, thank you guys very much. And I do want to end probably with this statement. Senator Pilskowski mentioned the employers earlier, and I meant to follow up. Washington isn't going to fix healthcare. The state legislature isn't necessarily going to fix healthcare, but the employers sure can.
Yeah.
The employers are the ones that have all of the leverage and don't know it. Too often they're held hostage by the insurance companies and the hospitals, because if they don't support a certain bill or an idea that's moving through the legislature, they're threatened with higher premiums or higher hospital costs. And that shouldn't be the case. And I think the employers need to assert themselves on behalf of their employees so that they can have affordable health care.
Great thoughts.
Thank you for that statement, David, because that is 100% accurate.
Well, I want to thank our panelists today for joining us. It's been a great discussion. I want to thank everyone who attended today. And just as a reminder, we will have this up on YouTube later today. So if you want to share it, we'd certainly appreciate it. Thank you, everyone, and hope everyone has a great day.
Yes.
Thank you.